And this weekend sees the end of daylight saving. Goodness me, thank God. I'm going off topic, but that just needs to be wrapped up weeks earlier. It is ridiculous. Anyway, some states, of course, are getting rid of it as winter draws nearer, as does the flu season. That was a dog leg. Paediatrician and infectious diseases expert Dr. Lini Fuong is here. Sorry about my rant about daylight savings. It just goes on and on, many weeks longer than it needs to. The flu.
It continues the rant.
Anyway, the flu. It's always dark when we get up, but it's even darker for longer. Anyway,
question.
Right. Sorry, everyone at home. Very self-indulgent. Are we seeing more flu already this year?
Yes, so it's a really interesting question because there is, obviously there are always flu cases happening, and so far we know that there have been about 24,000 confirmed flu cases this year. There were 63 deaths in January. I think what we need to realise though is that when we're looking at the data, last year we had a late flu season, and so what we're probably seeing at the start of this year is actually an overhang or a hangover rather of last year's flu, and so it's hard to tell whether or not it's a new kind of surge that's coming or whether we're just seeing later cases from last year. So I think really it's a good time to talk about flu. Talk about preparing for the flu as the flu vaccine starts to hit the shelves. Really kind of getting on top of it before the colder months hit.
Lini, we're hearing a little bit about the Super K strain. Can you tell us a bit more about that?
Yeah, so Super K has been talked about quite a bit. It's the nickname for one of the dominant strains of Influenza A that's been circulating. There's been a lot of it overseas, so the US, Europe and the UK have been talking a lot about Super K. And the reason why it's getting so much attention is because it's a lot more transmissible or a lot more infectious. So it means that people who are less immune are more likely to get it and I guess be hospitalised. Therefore, there might be increasing number of deaths. I think the good news, though, is that it is actually in the upcoming flu vaccines that are available.
When should you get your vaccine? Last year.
Good question.
I went early because I thought I wanted to be protected. And then in December, I got the flu.
Yes.
So I had it all over summer. So, what is the right time, to get the best coverage?
Yeah, so it's a really good question because essentially what we know is that it takes about 2 weeks for the flu vaccine to start working and giving you optimal protection in terms of your antibodies. What we do try and encourage is that people get the flu vaccine before we hit flu season and the peak of winter. Now is a pretty good time. In terms of that optimal protection, it's about 3 to 4 months that you've got of coverage. And so some people will get 2 doses of flu vaccine if they're going overseas, for example, or if they're at risk, they might get an additional dose. And so when we talk about at-risk people, children who are under 5, we've got people who are older, those with chronic medical conditions, and then pregnant women as well. So certainly there are people who are more at risk, more likely to get perhaps more severe disease. And then we also have those who are eligible for free vaccine as well. And this also includes our First Nations friends and colleagues. So I think it's a good time to think about the flu vaccine and time to get ready for it.
Now, some of us don't love a needle.
Yes.
Me. Although the flu jab is very, very small.
Yeah.
But there's an alternative now, isn't there?
Yeah, so I think good news for people who are a little bit needle phobic, particularly for the kids. So this year, in terms of our offering, there is now a nasal vaccine available for anyone aged between 2 to 18. So not for us, unfortunately.
I got so excited.
But so it's a live vaccine, so a little bit different to our injectable vaccine, and it's one dose up each nostril, and it's supposed to give comparable protection for kids for the flu. I think it's important to note, though, that it's not appropriate for everyone, particularly because it is a live vaccine, but it is a good option for kids who are needle phobic and also who don't have underlying immune system disorders. So, again, it's not a one-size-fits-all. There are different types of flu vaccines available for different people. So the injectable, there are older person vaccines as well, which are a bit more enhanced. Worth speaking to your GP or your pharmacist.
Just on that, before we let you go, this has been an issue that a lot of families have probably discussed off the back of COVID. When do you get it? Should you get it? What's your advice generally to families that come?
Yeah, my advice is always, you try and protect against the things that you can prevent because, obviously there are so many viruses and bacterial infections that you can't stop yourself from getting. I think the flu vaccine is such it's such a safe vaccine. The one thing that I want to kind of put out there is a lot of people will say that they won't get the flu vaccine because it gives them the flu. That is not correct. Because it's an inactivated vaccine, you're not getting the flu, what it does is it causes an immune response, and sometimes people who have a very healthy immune system have that really big reaction and they feel fluey. And so on balance, I think that's a lot better than getting the flu and having the risk of being hospitalised. So I think, 2 weeks before is essentially what you want in terms of optimal protection. Probably now is a good time.
Okay.
And then, speak to your GP or healthcare professional.
Lenny, thank you very much.
Thanks, Lenny.
Pleasure.
And thank you for the advice as well. We
Yeah.
need it on this show.